So, good morning, ma'am. My name is Mariel Joyce Colong. I am a second-year medical student from Davao Medical School Foundation. And today, I am in charge of performing the neurologic examination on your baby. So, may I know po the complete name as well as the age of the baby? Ang name niya po, Doc, is MJ Colon. He is 2 months old. Okay po. So, may I know po your name, ma'am, as well as your relation po to the baby? I am Merilita Colon. I am the mother of the baby. Okay po, so good morning po, ma'am Merilita. Okay, so for the neurologic examination, no, we will first be assessing the cranial nerves and then followed by the assessment of the primitive reflexes, which are the palmar grasp reflex, plantar grasp reflex, routine reflex, the moral reflex, as well as the asymmetric toe neck reflex. Okay? So, the procedures, no, I will be explaining it in details as we go along with the examination. So, would that be okay with you, ma'am? Okay lang po, Doc. Shall we proceed na po with the examination? Yes po, Doc. Okay po. So, we will start first with the cranial nerve, no? So, for the cranial nerve 1, which is the olfactory nerve, actually, it mediates, no, the sense of smell. However, it is very difficult to test, no, on infants. So we will proceed with cranial nerve 2. Okay. So for the cranial nerve 2, which is the optic nerve, no, in here we will be assessing, no, the visual acuity, no, of the baby. So I'm going to ask you, no, ma'am, to let your baby be in a sitting position. Okay po, thank you po. And then, we will be assessing for or observing for facial responses and tracking. Okay? So, assuming that the baby is having facial responses and tracking. Okay, so meron naman po, ma'am. So, we will now proceed with cranial nerve 2 and 3. So, these are the optic nerve and the oculomotor nerve, no? So, in here, we will be checking, no, for response to light and pupillary response. So, I will be using my pen light, no, to check for optic blink reflex. So, I will be dimming the lights first. Okay. So, assuming that the baby is blinking. Okay, so meron naman pong optic blink reflex po, ma'am. So now, we will be checking for pupillary reaction or response. Okay. On the other side. Okay, meron naman po, ma'am. So now, we will proceed with the cranial nerves 3, 4, and 6. Which are the oculomotor nerve, trochlear nerve, and the abducens nerve. So in here, we will be assessing, no, extraocular movements. Okay, so we will be observing for tracking as well as eye movements. Okay. Okay, so there is tracking as well as eye movement. So now we will proceed with cranial nerve 5, which is the trigeminal nerve. So actually, this cranial nerve has a motor and sensory function, but in this test or in this procedure, we will only be assessing the motor function. So we will be checking or observing for routine reflex as well as sucking reflex. Okay, so there is routine reflex na as well as sucking reflex. So now we will proceed with the cranial nerve 7, which is the facial nerve. So in here, we will be checking, no, for the expression of the baby. And assuming that the baby is crying and smiling. Okay, so upon observation, no, symmetrical naman po yung face as well as yung forehead ng baby. So now, we will proceed with cranial nerve 8, which is the acoustic or vestibulocochlear nerve. So we will be assessing, no, for the hearing of the baby. So, you'll be observing for acoustic blink reflex, okay, as I induce loud sound. Okay, so assuming that the baby is blinking, okay, there is ano naman po, ma'am, acoustic blink reflex. Okay, so now we will proceed with cranial nerve 9 and 10, which are the glossopharyngeal as well as the vagus nerve. So in here, we will be assessing or observing for any coordination of swallowing. Okay, so there is coordination of swallowing. Next, we will be assessing cranial nerve 11, which is the spinal accessory nerve. So in here, we will be assessing, actually this nerve is innervates the sternocleidomastoid muscle as well as the upper trapezius muscle. So I will be raising both hands and I will be checking for the symmetry of the shoulder. Okay, so meron naman po, ma'am. Next would be the cranial nerve 12, which is the hypoglossal nerve. Okay, so in here, we will be checking or assessing the coordination of sucking, swallowing, and tongue thrusting. Okay. Okay, so there is coordination of the swallowing, sucking, as well as tongue thrusting. So I will be also pinching the nose, and check for any reflex opening of the mouth. Okay, so meron naman po, ma'am. So now, we are done with the cranial nerve examination assessment. Okay, we will now proceed with the assessment of the primitive reflex. So, for this one, we will start with the palmar grasp reflex. Okay, I will be placing my finger on the hand of the patient. Okay, meron naman pong positive naman po. Next would be the plantar grasp reflex. So, I will be placing my finger at the base of the toes. Okay, there is curling of the toes. Next would be the rooting reflex. Okay, I will be placing my finger, the side of the mouth and check if there is opening of the mouth and whether the baby will move towards the area of stimulus. Okay, so there is a rooting reflex. Okay, next would be the mono reflex. For this one, okay, the baby will be in supine position. And I will be supporting the head, the neck, as well as the back. And then I will be abruptly bringing down the baby 2 feet below. And then I will be checking for any extension of the arms as well as the legs and opening of the hands. Okay, one more time. Okay, so far meron naman po. Then next, will be the asymmetric tonic neck reflex. Okay, so for this one, okay, we will be checking, whether the baby will extend the arms as well as the legs, towards where I will turn the head. So I will be turning the head to the right. Okay, so there is extension of the right arm and the leg, and then the opposite side are both flexed. Okay, so that's it for our neurologic examination. To summarize, ma'am, we have assessed the cranial nerves. So far, lahat naman po ng cranial nerves are normal. And then also, we also have assessed the primitive reflexes. Normal naman po lahat, based po sa age ng baby, which is 2 months. Okay, so Usually, if for example, for the reflexes, no, some reflexes are only present, no, up to 3 to 4 months or 2 months. For example, the asymmetric tonic neck reflex, it is only up to 2 months. No, if it persists, no, there may be abnormalities. We usually do this, no, neurologic examination to check for any abnormalities na hindi natin napansin. Hindi, para ano po, para iwas po complications in the future, no? You'll be able to address it right away. Okay, so do you have any questions before we end our examination? Wala na po, Doctor. Thank you so much and have a great day.